I'm Shelly Sun, the CEO and founder of Brightstar Care. At Brightstar Care, our short-term strategic priorities are to grow our home care customer count and hours network-wide by broadening the addressable market beyond private pay. Particularly during periods with macroeconomic pressures, proactive diversification of payers is critical so there isn't an over-reliance on discretionary household budgets. Fortunately, we began six-figure annual investments in 2018 that are bearing fruit. We are leaning into Medicare Advantage to learn and experiment, following law changes that allow Medicare Advantage plans to pay for supplemental personal care hours with providers that are not Medicare certified. We're aligning with the most thoughtful payers that value quality and will pay for it. We don't see Medicare Advantage being the majority of our market share, but we do see it playing an important role in client acquisition and retention in the coming years. Data will be our most significant driver to align our network with Medicare Advantage and other reimbursement and payer options. We're undergoing a digital transformation, utilizing data tools such as Power BI and continuing projects with Avalier to capture and reinforce our superior clinical outcomes. Data provides us a powerful tool to negotiate favorable pricing and upside incentives as we demonstrate our improved outcomes and healthcare cost savings. And collecting this data is necessary to validate our hypotheses around Medicare Advantage and draw conclusions on our strategic investment decisions. The industry-wide labor challenge is something we're facing as well. We're doing more to attract and develop talent by forging partnerships with notable entities in the healthcare space, like Chamberlain University, the leading and largest nursing school in the country. Through this partnership, we're creating a pipeline of new and qualified home care nurses that our franchise network can tap into. Brightstar Care is transforming to align with industry changes. From an operational standpoint, we have already made strides to invest in and expand our technology and data teams. We have grown our corporate-owned footprint from 3 locations in the Midwest to over 30 locations spanning from coast to coast in less than 2 years. Through our Brightstar-owned offices, we can pilot new payer and reimbursement models and accept Medicare Advantage plans and other key national account referrals. We are also piloting opportunities for centralization of functions and new vendors and technologies such as AI to improve efficiency and profitability. We can use insights and key learnings from these agencies to benefit our entire franchise network. This helps to grow our franchisees' valuation, operate efficiently at scale, and diversify their skilled care offerings and their payer capabilities across a wide range of revenue opportunities. We recognize that our caregivers and nurses are a critical piece of the puzzle, so we have heavily invested in retention measures, including career pathing, recognition and reward technology-enabled programs, and continuing education. The Recognition and Reward Technology-enabled program allows us to scale our company culture and boost our team engagement virtually with rewards tied to behaviors and instant recognition within a platform that enables teams to communicate instantaneously, creating a true care community within the local offices. We are also experimenting with incentives tied to productivity, as well as with full-time salary models for field staff and sources of non-traditional part-time workers to meet the short shift needs of Medicare Advantage clients. Additionally, we honor and recognize our caregivers with our annual Best and Brightest Nurse of the Year and Caregiver of the Year awards. We select 4 outstanding nurses and 4 incredible caregivers amongst hundreds of nominations submitted by our community of clients and staff. Winners selected receive a scholarship or financial reward, a surprise ceremony at their home agency, and national recognition at our annual conference. These programs drive retention and are critical given the tremendous work our care staff delivers every day. We are also forging partnerships to create career paths for our caregivers, nurses, and future generations of healthcare workers. We partnered with Chamberlain University, the leading and largest nursing school in the country, to create a co-branded home healthcare course to be offered on campuses and online. In the long term, this home health initiative will build the number of qualified home health nurses who practice evidence-based care and offers a career path to invest in Brightstar Care existing and future nurses. Labor costs have risen over the last few years, but to optimize margins, we are focused on maximizing staff utilization, retention and incentive pay programs, as well as leveraging technology automation and centralization. We are diversifying beyond private pay to boost the number of hours caregivers provide clients, to maximize the employee and customer experience and aid in retention. Accessing and engaging with Medicare Advantage plans allows us to form relationships with Medicare Advantage beneficiaries that are potential private pay clients down the line for their supplemental hours beyond their Medicare Advantage benefit. The initial hours for Medicare Advantage may not be financially sustainable in a vacuum at the initial rates when we began 5 years ago, but we have proven our worth as a preferred provider, grown volume, and increased rates. Medicare Advantage is a worthwhile investment because if our franchisees do not engage with Medicare Advantage now, there will be 30% or so fewer clients to service later. Getting involved is critical, and based on the current data, I believe you must look at Medicare Advantage as a key form of client acquisition and factor it into the cost of doing business. Medicare Advantage will also impact client retention for existing clients that may be eligible to have a portion of their costs covered by their Medicare Advantage plan. To make these relationships more advantageous and for Medicare Advantage plans to want to continue to expand coverage for personal care, providers need to demonstrate the value that service provides. Medicare Advantage plans will be looking for evidence of value, either through customer satisfaction and retention or by improving outcomes and lowering costs. We're working closely with Medicare Advantage plans to become the provider of choice for their beneficiaries and showcasing our differentiators that drive quality through nurse-led care. Our strategy is to utilize data to demonstrate to our franchisees why engaging with Medicare Advantage plans is beneficial for the longevity of their businesses and to showcase how rapidly the market is evolving. And I believe our data will set us apart from competitors.